I'm Joe Turcotte, Communications Director at the Group Health Foundation. During the webinar, I'm going to talk about the campaign toolkit we created to provide organizations like yours with a proven campaign strategy and materials that can be deployed quickly in the event of a whooping cough epidemic. The campaign was deployed by the Group Health Foundation in partnership with the Washington State Department of Health and other health partners. The webinar will talk about the context of the campaign and the epidemic we had in 2012, the strategy and recommendations, and then the contents of the toolkit that are available online. So as you can see from this chart, in 2012, Washington State experienced a whooping cough epidemic with over 5,000 reported cases that year, compared to fewer than 1,000 the year before. And the campaign goals were pretty straightforward at the beginning: raise awareness of the epidemic, and then also to increase immunization rates. We started with a quantitative survey in the spring of 2012 that polled 400 women with children in the household, and we tested attitudes, opinions, and barriers around vaccination. And what we found was really high awareness of the epidemic. We saw really high likelihood to get yourself or your child vaccinated, but we also saw some confusion around vaccination status. We saw much higher rates of people reporting that they didn't need to do anything else to protect themselves than what we believe to be immunization rates at that time. So we really attributed that to confusion about Tdap and Dtap, how long it lasts, and so forth. So as the campaign moved ahead, we integrated that into our strategy to really clarify who gets what vaccine and when they need it. You can find much more detail about the research we did in your toolkits. So after 2 years of implementing the campaign, our recommendation is that as much as possible to use an integrated campaign with any number of channels. In today's fragmented media environment, you need multiple vehicles and channels to really be assured that you're reaching your audience. If you're overly dependent on any one particular activity, such as public relations, advertising, or a static website, you can be sure that you're really missing some of your audience. And of course, not everyone will be able to implement an integrated campaign like this, but the idea is that you deploy as many different tactics and activities as you can, as your resources and budget will allow. So the basic recommendations for implementation are, this integrated campaign that I mentioned before, but also identify a specific hook that can motivate action. For us, it was free vaccine clinics that really got people interested and served as a new bit of information for people to learn. Then as we got into 2013, we used a Win Free Diapers for a Year contest where we actually gave away free diapers for a year, which drove some traffic to our website. And then also localize your campaign. Make it specific to the community that you're in, so that you have a deeper level of engagement with your target audience. And also work with the local influencers and organizations that can help you get the word out and also develop content and plan. We found that we just gained a tremendous amount of capacity, reach from the different partners that we worked with that included the State Department of Health and local health departments in helping us with information and outreach. Planning partners are critical. And then also leveraging existing community events. Go to where people already are. It's a great way to expand your reach. A little bit more about partnerships, which we feel are critical to any endeavor like this. And there are a few different categories that the partnerships fell into for us. And really important was our planning partners. And again, that was our local health departments and our State Department of Health that helped us design the campaign, make sure our content was accurate and in line with current recommendations, and that our data was right. And the planning partners also helped us really understand the community in a way we could not have done alone. So critical are our planning partners. So when you're getting started on something like this, bring others in that can help bring expertise. And then another important group of partners are those that can help you execute outreach. Those community organizations that are willing to communicate on the campaign's behalf. And for us, these were YMCAs, they were schools, they were parenting groups, they were large employers. When we were at the height of our pertussis epidemic, we did not really run into any organization who didn't want to help. And it's a really efficient way to help get the word out. And our toolkit goes into this in depth. And also an important part can be a funding partner. There are some hard costs associated with the campaign, particularly the way we did it, from developing a website to paid media. And there are funders such as health organizations, local foundations, that could come to the table with dollars to help implement some of those hard costs. So keep these three categories of partnerships in mind as you get started on a campaign. In the toolkit, we've tried to provide all of the finished pieces that were based on our research and experience that could help any organization implement a similar campaign at any different level of intensity. And these are the key messages and facts that we use, all of the different correspondence templates and outreach that we did to invite others to join the campaign, also public relations and social media samples, and then a sample online ad campaign, and then the creative materials that we use. You can see examples of all of these. Many of them can be easily customized for your own community and your own organization. And they are there to be used by others, so please feel free to use them. These were the simple key messages that we used in the campaign, and you can see that these are pretty straightforward, reminding people that vaccination is the best protection. And then ask your doctor, importantly, about your vaccination status, because in our research we did see that there seemed to be a great deal of confusion around vaccination status, and we wanted to remind people that the healthcare provider is the best place to get that information. There's much more about key messages, and particularly in target audience, we did a lot of focusing on pregnant women and caregivers of small children. So if you refer to the toolkit, you'll see a lot more in-depth information about not only messages, but our target audiences as well. And as you can see here, we have a full range of correspondence templates to do just about anything you might want to do when engaging your community. We have all kinds of templates. We have talking points for calling people. We have email templates that your partners can use to reach out to their audiences, and then also templates you can use to reach out to local blogs. So there is a variety of different materials that we use for outreach. Again, these can be customized for your organization and your community very easily, and we encourage you to do so. You'll also find sample press release and drop-in articles that were really the foundation of what we did in terms of public relations. We had a lot of success with the media outreach during, especially in the height of the epidemic, and a lot of this was based around the availability of free vaccine clinics that we set up, and there's more information about that in the toolkit, but we felt like free vaccine clinics were going to be a key to our campaign, especially for the uninsured and underinsured communities, and we wanted to make sure if we were going to be creating demand for the vaccine, that we would have access for underserved populations out there. So we worked with our local health partners to put on free vaccine clinics for under and uninsured individuals. We also have a lot of information about social media work, and that includes template Facebook posts, template tweets, and also sample blog posts again, to make it easy for both your organization and sharing this with other organizations. We had any number of third parties doing social media outreach on our behalf, and so we would always send them sample tweets and posts, and we feel like the key to working with partners and getting them to help spread the word to make it easy as possible for them. So this means finished materials that are ready to go that they almost just have to press send on. We had a lot of success with that. And you'll also find in the toolkit an advertising strategy and some cost information, from targeting, how to maximize your use of search engines, particularly Google, and then a sample media buy and what we did. We designed the advertising strategy that we included in the toolkit to be as cost-effective as possible. I mean, we understand that around the world of public health, there's such limited resource to do work like this, but it can be a highly effective tactic. We strongly recommend online advertising. So we've included strategies and tools to implement advertising campaigns. This is, again, another great opportunity to potentially bring on a funding partner. You can include that funding partner's logo in your materials and so forth. So if it's possible, always recommend bringing on a funding partner, especially for paid advertising. And more sample campaign creative, you can see our website and how we treated that. You can see our TDAP, DTAP diagram front and center there. And then a sample of the outdoor we did in one county. I want to spend a little bit of time on this chart because this proved to be a highly effective part of the work we did, which was around clarifying DTAP versus TDAP, who needs it and when. And we were hearing from our providers in the communities that we worked in that this was really an effective piece for them, and they were letting us know that this was the most simple, easy-to-use graphic they had to share with their patients to get them this much-needed information on these vaccines. So we distributed about 54,000 of these in the community, and we strongly recommend getting this graphic out as often as possible. We did it primarily through informational postcards. You can see a Spanish version of this. But again, we printed as many of these as we could and distributed them as far and wide, and YMCAs and child cares and provider offices, pharmacies, so that this very simple information was available in as many places as we could get it. Here's a sample of the flyer to promote the free vaccine clinics that we put together. Pretty straightforward. We had about 7 in 2013. These were not as well attended as those that we put together in 2012 when the epidemic was at its height. We noticed a real drop-off in demand for the vaccine as soon as the number of cases trailed off and the presence of pertussis was much less visible in the media. And here's an example of a button that we distributed to some of our community pharmacies, and pharmacists around the state were wearing these, hoping to engage their customers. And in these pharmacies, pertussis vaccine was available, so another point of access and raising awareness around the epidemic where the vaccine is available. And there's a lot more information in the toolkit around the results that we found, but again, really we are very pleased with the number of community organizations that participated with us over the 2 years. We distributed almost 55,000 postcards, had a significant amount of traffic on our silencewhoopingcough.org website, and generated a number, almost over 15 million media buy impressions. So we have those results in greater detail in the toolkit, so we hope you will take a look at those. And finally, thank you for watching our webinar, and please feel free to contact me if you have any questions about implementing the campaign in your community. Our hope is that you will contact us, and we are willing to provide some technical assistance and advice and share more information about our experience in addressing the whooping cough epidemic in Washington State. Again, thank you.